30.
Debate, interviews, and breaking news. The Elias Macco Show.
News Talk Radio, CJAD 800, the voice of Montreal.
Unmistakably Canadian.
It's the music that raised you.
The artists raising the bar.
Hi, this is Brian Adams.
Hey, my name's Brett Emmons. I'm from the Glorious Sons.
Hi, I'm Nelly Furtado.
Made in Canada. The station that champions Canadian music.
Loud, proud, and all yours.
No passports required. Just press play.
Tap into Made in Canada now on iHeartRadio.ca
or the free iHeartRadio app.
Trudy Mason sitting in for Elias again this week. We've had some recommendations from the Quebec Association of Psychiatrists aimed at improving access to mental health care across the province. We've been talking a lot about this for a variety of reasons. One being the link between mental health and homelessness. Another, rising concerns about the mental health of our young people here in Canada. So, a list of recommendations from the association that it says would improve access to care. Here to speak to us about these recommendations, Dr. Leon Tourian, a psychiatrist, a clinician scientist, and a medical educator at the McGill University Health Centre. Dr. Tourian, thanks for joining us.
Thank you for having me.
I would have said on the surface of things that access to care has been a problem for quite a while now, and the simple solution would be more psychiatrists, more psychologists, more access to counseling. Is it not that simple?
I think it's a complex question in terms of answering the question of access, and I think our focus is actually making sure that we are organizing care so that people in need actually have access in a timely way, and so that involves kind of looking at the care delivery in a bit of a different way, making sure that we're accessing, we're giving access to care, to patients within their community at home. So changing a bit of the models, because the hospital-centric model, it doesn't work. It works for acute things, of course, but we're trying to get people outside the hospital, taking care of them in their community, and that involves like a bit of an overhaul of our care models, and we have. There's a lot of initiatives to do that, and they just need to be supported, and that's part of our 6-point request to actually change the way we deliver care and come closer to patients so that essentially we could care for people more effectively.
Could you perhaps go into the example of telemedicine when it comes to mental health? I think we saw the rise of this really during the pandemic when getting together for one-on-one sessions was problematic for a lot of people. How would more access to counseling via web platforms or Zoom, how would that change things?
So that's an excellent question. I think we need to appreciate that some of the vulnerable areas of our province, are distant areas. So access to care is very difficult, or a patient might be in a very difficult physical situation, or maybe just gave birth, or maybe is pregnant and can't travel, or maybe there's family that want to get involved in care, and not everybody could come down to see the doctor in a specific location. So those reasons make it that telehealth is basically something we are pushing for, so that it's a little bit more systemically ingrained in our system, so that we could access patients in their environment, and even if we're at a distance, we could do that through telehealth. So we really want to protect telehealth for those reasons, to kind of access folks that may not find it easy to get to the doctor, but with telehealth, that's we could access anybody anywhere essentially and provide care.
What are some examples of other measures that you think would on the ground mean faster, easier care for people who are seeking it?
So I think I'd like to emphasize a few of the things that we're trying to encourage is, at-home hospitalization. So that example is, an innovative way of approaching care. And essentially what we do is keep the patient at home, do daily visits, and essentially follow up on their progression while they're at home. This has the benefit of basically, freeing up space in our hospitals for folks that maybe don't need to have that environment, while keeping them at home so that they don't decondition, especially our elderly patients. And so that one measure is really interesting because it essentially provides an environment that is familiar while having a framework that provides care. So that's one. And another one that we're really promoting is having, mobile crisis units. There's a lot of times that mental health crises are more of a psychosocial crisis. Like there's a crisis in the family, there's a crisis in a relationship, or an individual is going through a rough time, and they might not need to come to the hospital. And if we had mobile units to deal with psychosocial crises, we could have people going into the environment where the patient is at home or in their community, and helping them out instead of them having to see a psychiatrist, which oftentimes they don't when these kind of crises are coming about. So there's a few of them that are implanted, and we just want to kind of promote that even more. And the last one that I'll promote for, because it was really something that we focused on yesterday, is the outreach for our homeless populations. So having, built-in systems where each of our big hospital units have teams that go out into the environment. So us is reaching out to the patient is really the focus. So we have a few of those. It's the PRISM model. And so we're really encouraging this model as well because it basically makes a huge difference. It basically decreases the amount of times that they come into hospital, folks come into hospital, and that they need interventions from various partners, including police. So that's a good model that works, and we want to promote that across the province.
One of the recommendations that kind of surprised me at a time when there's been a lot of criticism of the bureaucratic burden of all kinds of healthcare is the call for a minister devoted to specifically mental health, a ministry all on its own to handle healthcare matters. Why would that additional layer of bureaucracy be seen as optimal?
That's a great question, and I agree with you that we're in a trend where we're seeing a lot of increase in bureaucracy. I think our aim for wanting a mental health minister is because one, the needs are they're much more complex than they used to be. And we want to engage more with somebody who can make a difference. So we want somebody who's accountable to mental health. We want somebody who we could partner up with. And that's the major reason why we've came up with these recommendations, is that we want to be an active partner in these. And so having a minister that actually takes care of it, we're not wanting to increase bureaucracy. We just want oversight, and we want to have a really intentional portfolio for a minister that's taking care of this, so that it's not swept under, the huge banner of health or the huge banner of social services, so that it really has a place where we could have, a co-development of projects and have specificity and accountability, and that's what we're really looking for. And that's why we made the request. We're very cognizant that we don't want more bureaucracy. We just want more intentionality in terms of how government is basically managing mental health, and we think that the current landscape requires it because things are getting more complex and the care models need to be changed. And so we need a partner that's actively kind of engaging with those specific dossiers, whereas in health, it's kind of lost a bit or potentially lost. So that's why we're promoting a very specific a point of getting a mental health minister to be able to do these things in a very intentional way, so that we could really actually make change and really make a change for patients across the province that need specific types of help, that need an update. And we're really engaged in wanting to work with government to do that.
Circling back to my original question then about, isn't it also a case of just more psychiatrists and more psychologists? Are there no measures on the landscape to increase med school enrollment, for example, or to multiply undergraduate degrees or master's degrees in related mental health related fields? Do you feel that the other measures you've recommended would eliminate the need for more on-the-ground qualified people?
Yeah, that's an interesting question, and I think that's where we're a bit mindful of our appreciating the realities in Quebec. Is we have a lot of psychiatrists in Quebec, and we have a lot of psychologists in Quebec, and I think that the point we're trying to make is that the way care is organized and some of the programs that are being advocated for need to align with more of the realities of our communities. And so that's a bit of the push that we're really wanting to do, is we want to make sure that healthcare trajectories are really aligned to get to the patient within their environment to be more efficacious. And right now, the healthcare models need a bit of an upgrade. So it's not more psychiatrists that's going to actually be the solution. It's actually reorganizing care and having programs that do that. And that's where, we need that specific type of help from the government. So more doesn't need better. It's just that it needs to be better organized. And we're very keen on engaging with that. Because we do have a lot of psychiatrists, we do have a lot of psychologists. In fact, Quebec is one of the higher number per population of both of those resources. It's just the way the care framework is organized. It doesn't reach our patients when they need it and in an appropriate way.
Dr. Tourian, thank you very much for the interview.
Thank you very much for having me.
Dr. Leon Tourian is a psychiatrist, a clinician, scientist, and medical educator at the McGill University Health Center. Time for us to go to
the newest tracks. Let's go. New music. And the next big thing.
Always on the new music first.
Your first place to hear it all.
'Cause you gon' like it, love it, wanna play it twice. Playing now.
iHeart New Music. Your digital station for brand new drops, fresh finds, and tomorrow's bangers.
I think we need something new.
Discover iHeart New Music. Always fresh, always first. Stream now on the free iHeartRadio app.
Breaking news. Considered. The Elias Macco Show. News Talk Radio. CJAD 800.
You might have heard this mentioned in Tom Whalen's news this morning, some reporting out of the Gazette revealing that 28 medical specialists have opted out of Quebec's public insurance plan, basically Medicare. They've left the Medicare system for private practice entirely. That is this year. 28 doctors have left. Some are dermatologists, some are ophthalmologists, some are experts in plastic surgery. There's also orthopedic surgeons who have left. And this comes at a time when there are long waits for certain medical specialty consultations and treatment. So patients are always concerned to hear this. Here to help us understand what is going on behind the scenes that may be driving what is happening is Xavier Gauvreau, president of the pro-Medicare group Médecins Québécois pour le Régime Public. Thanks for joining us, Xavier.
Thanks for having me.
Your group is in favor of Medicare and bolstering Medicare. Does it distress you to see that 28 specialists have opted out of Medicare?
Of course it does, but if we take a step back, it's not only 28 this year. It's 28 that is adding up to more than 800 doctors that are out of the public system. And that is a new phenomenon. 25 years ago, there was close to none physicians that were opting out of the public system. So if we take a step back, it's quite an alarming rate.
Can you compare it to what's going on in other provinces? I was under the impression that some other provinces don't allow this type of thing.
Yeah, you're right. So it depends on the province, but the laws are different by province, and the Quebec is the champion of privatization because we're the only ones that allows this type of private practice. Some other provinces like Alberta does have some private doctors, but we're not close. It's close to a few tens of doctors in the other provinces, and we're close to 1,000 in Quebec. So we're the champion.
We did hear a lot of anger from doctors last year when there was a back and forth on contract negotiations, remuneration, I should call it, remuneration questions with the Legault government. It was a very bitter negotiation. And at the time, a lot of doctors were saying, listen, we're so angry, we're looking at options, leaving the province, going to practice elsewhere, or jumping off of Medicare. Is this an extension of that to your mind?
In a sense, yeah, because if we take a look at the doctors that are opting out, we see a lot of surgeons or anesthesiologists, for example, and they're saying, since a few years, they've been saying that we cannot operate in the public system as much as we'd like to. The president of the Quebec Surgeon Association said that the normal surgeon operates 4 times a month currently in the Quebec system, but what they would like to do is 6 times a month to clear those waiting lists. So they cannot operate at the level they would want to do. So the frustration is there for a reason.
Yeah, and I think that's important to point out because I think some Quebecers would say, oh, this is just greedy doctors want to go into the private system to line their own pockets. And when you see that dermatology is on the list of specialties where some people have less, all they want to do is make more plastic surgery. They just want to make money from rich people. But it seems to me that there's that's really slagging doctors who are, in some cases, really frustrated by their working conditions and the fact that they can't operate, they can't help as many people as they would like under Medicare.
Yeah, you're right. We see that with dermatologists, we see that with surgeons, we see that with other specialties. Unfortunately, I think that the physicians that make this decision to opt out of the public system, sometimes they don't understand all the consequences that leave on the physicians that are still in the public system because they are not on call anymore. They don't share the burden of the complex cases in the public system. So it's kind of a vicious circle. It gets tougher and tougher to operate or to practice in the public system when people are leaving behind.
The province was supposed to make it tougher for doctors to do this, to switch entirely to private practice. Is this not working? If it's not working, what more is needed?
That's a very good question that we should ask to Santé Québec, because when they passed the Bill 83, it was supposed to be tougher. You were supposed to receive an approval from Santé Québec to be able to opt out of the public system. What we've seen in the last 2 years since the law passed, or a year and a half, is that all of the requests, or almost all of the requests from the general physician have been refused, but we're seeing many requests from specialists accepted, like these 28 that were accepted this year. And in theory, Santé Québec should refuse those requests if it has an impact to the public access to healthcare. And in our opinion, Médecins Québécois pour la Hygiène publique, that's the case right now because there are waiting lists in those specialties. So we don't understand why Santé Québec doesn't use its broad discretion to refuse those opting out.
Yeah, when you think about it, the burden by those left in the system, orthopedic surgery, you talk to someone who's been waiting for a knee replacement, or even when I had a hip replacement last year, I had been on the list for 8 or 9 months, and you have to wait in pain for that. A way ahead, is there a proposal by Médecins Québécois pour le régime public as to just how big a crackdown there needs to be or how it could be engineered?
Yeah, well, I think one of the solutions that could be put into place is that currently almost 25% of our operating rooms in the province are closed due to a lack of staff. And since the creation of Santé Québec, we were in an austerity period, so we could not spend more. We had to cut budgets. But if we were to increase our budget and permit those operating rooms to reopen or to work after normal operating hour, we could reduce by a lot this waiting list in the public system. So I think we could offer some better conditions, and we could pay for temps supplémentaire, sorry for the French here, to have a better functioning public system. So that would be the first step.
All right. Thank you very much for sharing the thoughts of your group, Xavier. Much appreciated. Xavier Gauvreau is president of the pro-Medicare group Médecins Québécois pour le régime public. Thank you.
Thank you for having me.
When we come back, we will take a look at a study that shows the longer you watch TV in midlife. So if you're going through your 40s, your 50s, and you're spending a lot of time, with Netflix, the worse it is for your brain as you age. So if you're in midlife, there are things you can do now that may be brain protective in the long run. That's all coming up after we get an update from the news. It's Jason Mayoff across the glass for me in the news booth. Stay tuned.
Canadian women are looking for more out of themselves, their businesses, their elected leaders, and the world around them.
And that's why we're thrilled to introduce the Honest Talk podcast.
I'm Jennifer Stewart.
And I'm Catherine Clark. And in this podcast, we interview Canada's most inspiring women.
Entrepreneurs, artists, athletes, politicians, and newsmakers, all at different stages of their journey.
So if you're looking to connect, then we hope you'll join us.
Listen to the Honest Talk podcast on iHeartRadio or wherever you listen to your podcasts.
Missed something?
Subscribe to the Elias Macco Show podcast to catch up.
Available on iHeartRadio and wherever you get your podcasts.
So you probably know that spending a lot of time on couch watching TV is probably not that good for you. But did you know that what you do in midlife may have repercussions decades later on the brain? That's coming up.
Voices you trust to deliver the news. Here's what's making news right now.
And help you make sense of it.
What's scaring Quebecers the most?
The key message here, though, is
the station Montrealers have relied on for 80 years. Your station.
Your voice.
News Talk Radio, CJAD.
Hey, I'm Ruby Carr, the host of the podcast Encore. Check out our brand new episodes featuring music from the show that everyone is reheating as we speak, Heated Rivalry. Join me as I go behind the songs that brought Shane and Elia together. I'll tell you the stories of Feist, My Moon, My Man, Wolf Parade's I'll Believe in Anything, and Tattoo's All the Things She Said, and how they all became a part of this global phenomenon. Stream Encore on iHeartRadio, Crave, or wherever you get your podcasts.
Stories impacting Montrealers. News impacting Montreal. The Elias Macco Show. News Talk Radio. CJAD 800.
Nothing like kicking back on the couch, maybe with a nice warm beverage or something cold in your hand after a long day's work while you watch your favorite TV shows. But there is research suggesting that if you spend long periods watching TV during midlife, there can be changes in the brain that will come back to haunt you decades later, including smaller brain volume, more signs of damage to small blood vessels, and a significantly higher risk of developing dementia. Here to help us understand more about what we do to ourselves when we watch a lot of TV is Sylvie Belleville, Canada Research Chair in Cognitive Neuroscience of Aging and Brain Plasticity at the Université de Montréal. Sylvie, welcome to CJAD.
Hi, thank you. Nice to be here.
Tell us what science is learning about spending long periods in midlife watching TV.
Well, that's a very important question because we've known for many years actually that sedentary behavior, which is defined as, doing things that don't consume a lot of energy. So it can be lying down or sitting or even, just doing very low energy activities. That's associated with a bunch of negative outcomes. But there's this very recent study that's quite fascinating. It's a study by a group of American people led by Nathan Fetter, and it actually looked at a cohort of people. So people were recruited when they were around 50, 55, so middle age, and they were followed for many years, and they could look at the brain and what predicted brain changes. So that was a longitudinal study. That's really the strength of that study. And they looked at sedentary behavior in your 50s, right? And whether that has an impact on how the structure of the brain evolved as people get older. And they report that fascinating study where they found that about 25 years later or something like that, the activities, the amount of sedentary activities that you had during your 50s had an impact on the brain structure, as you mentioned. So there were more white matter hyperintensities, meaning that your small vessels were not really healthy. There were less volume in regions that are known to be affected by Alzheimer's disease. So that's really important. But what is more interesting in that study, I want to stress that, is that it depends on the type of sedentary behavior you have. Because when you're in your 50s, people are working. Most of the people are working. So if you're a person, I'm working and I'm sitting when I work, so I don't really like these data that show that sedentary behaviors has such a negative impact. But what this study shows is that there's a big difference between sitting in front of television, so cognitively passive sedentary activities, versus sitting when you're working, you're engaging, you are cognitively stimulated, you're problem solving. So that's actually associated with better structural brain health. So less white matter hyperintensities and larger volumes. So what sitting, sedentary behavior is not good physiologically, we know that. But what you're doing when you're sedentary makes a big difference.
Well, I think I had a moment of panic when I read the news coverage of this study, because we can't go back and change what we were doing when we were younger. Is there any suggestion of anything older people could be doing now if they're willing to acknowledge, you know what, I did spend a lot of time doing nothing but watching TV, with that mentally passive posture, and on the couch I'm not mentally engaged, I'm just receiving what the TV is handing me. Is there anything we can do now to counteract all those years?
Oh, that's a very good point, because indeed this study focused on what you do in your 50s, and it showed that indeed has an effect. But there's a lot of studies that show that it's never too late. So that's what I tell patients and older adults when I meet them: never too early, never too late. It's never too late to change your lifestyle. So there's quite a few very convincing, strong studies showing that people who engage in either cognitively stimulating activities or physical activity later in life, that can have a positive impact on your cognition, on your attention, and on the brain structure. So definitely, there's something you can do as you get older. It's not too late. What this particular thing shows is that there's a bunch of things you can do to promote your brain health.
All right, let's get into some advice and details, because I think all of us want to think that there is room for improvement, right? Mm-hmm. So what would you suggest, for example, to someone who is, when you're talking about it's never too late to start with more engaging activities, what course of action would you recommend?
Well, the first action I would recommend is look at you. What is your, where are you at risk? So the recent literature has shown that, for example, there's a lot of factors, modifiable factors, that are associated to cognitive decline as people age, or to Alzheimer's disease or other related dementia. So these include having a bad sleep, being sedentary, low physical activity, low cognitive engagement, bad nutrition, vascular cardiovascular risk factors, being socially isolated. So these are all, and one other factor which I think should be stressed as well is vision and hearing. If you have problems with vision and hearing, it comes with a lot of negative behavior that has an impact on cognition. So where are you at risk? So I think that would be the first step I would recommend. So evaluate yourself, because these factors are all relatively similar in terms of how much risk they are associated with. So there's not one magic bullet, if I wish. So if you're at risk in one or a few domains, I would start there. And I would start with low-hanging fruit. So what is easier for you? Where are you more motivated? Are you more motivated in maybe changing your nutrition pattern or maybe changing your physical activity? And if you are more motivated in changing your physical activity, start slowly. Don't expect to be perfect in a month. Go one step by one step, following each other. That's the best way to change your behavior. You don't want to be discouraged. You want to keep your motivation, and you have to do things you like. Fun is important. If you like to walk. If you like to do things with people, try to select an activity that is close to, that allows you to get it with other people. So these would be the advices I would say. I don't think that there's one magic activity. I think that it all depends on how it can be integrated in your own context and real life.
I have some questions in by text from our listeners who, and I was going to ask about this because when this study started, the people watching TV were that was probably the only screen they were looking at. Maybe some of them had computer screens at work, but now we have computer screens everywhere, including in our hands with our phones. Do you feel that the danger is just as great if you're looking at a screen on your phone, on your computer? Again, if you're in this passive, non-working mode, and is multitasking any better? Can you if you and your spouse are watching a TV show together, but you're interacting and commenting on what you're seeing, is that better?
Oh, interacting is great. There's some indication that if you're looking at television, but you're discussing what you see, that provides some intellectual stimulation. Computer is an intriguing question because there has been some studies showing that in older adults, it actually protects if you learn computer. And it makes sense because older adults will use computers to get to new information or to watch documentaries or to connect with their family. So older adults would probably use computers in a different way than maybe younger adults who use them a lot, who could use them in ways that are less stimulating. So I think it's not really the medium that is important. And that's one thing I would like also to stress. It might be how you use the medium and what it provides you. So if you use a computer to get stimulated, to open yourself to the world, it's probably positive. But if you used computer to do always the same thing, to not stimulate yourself, to stay inside your comfort zone, then that might be a problem. Same for TV as a matter of fact, because if you watch documentaries and debates, and that creates lots of interaction and it broadens your scope on the world, it's probably more positive or quite positive. I'm not sure I would say that's wrong. So we really need maybe to understand better the content of these medium.
Well, Sylvie Belleville, on behalf of all of us, thank you very much for your work in this domain, and please carry on because we need all the information we can get. Sylvie Belleville, Canada Research Chair in Cognitive Neuroscience of Aging and Brain Plasticity at the Université de Montreal.
You've heard the chaos. Now you can see it. Oh my God. Watch all your favorite podcasts from start to finish right inside the free iHeartRadio app.
Gets the blood going, huh?
Catch every laugh and eye roll on shows like the Tom Green Farmcast and Park the Bus. Now with full video.
We're building a ramp for Tony Hawk.
the same hosts and the same chemistry with all the hilarious moments you've been missing right on your screen. Cheers. Open the free iHeartRadio app, search video podcasts, and tap watch.
The Elias Macco Show. News Talk Radio. CJAD 800.
Trudy Mason sitting in. What is going on with the kids? Because apparently the kids ain't all right. Kids Help Phone says it is tracking a significant increase in overnight text messages from young people across Canada. So that means young people are increasingly calling during those late night hours. Here to help us understand what's going on is Aaron Sanderson, President and Chief Executive Officer at Kids Help Phone Foundation. Aaron, thank you for your time this morning.
Thank you for having me on the radio show.
What kind of increase are you seeing in overnight texting?
It's actually really quite dramatic. There's been a 183% increase in texting volume at night compared to our daytime hours, which is unusual for us and displays for us the need that young people have for support more than ever before.
I think it also indicates that kids are losing sleep.
I think that's true. And we know that when young people are sometimes by themselves with their thoughts, they have a private moment to sort of process. They are thinking about what they might be returning to the next day that might be causing them some anxiety or fear. That's often when we can be the most help, when they have that privacy to talk to one of our clinical staff and whatever might be troubling them.
And text messaging as opposed to phone calls, is that a trend that you're looking at as well?
It's actually really quite interesting. So we've had this surge specifically in our texting service, but we, of course, have been providing phone-based counseling since 1989. And what's interesting, when we originally introduced the texting service back in 2018, we wondered, would all young people text instead of call? But what we found out was young people appreciated the choice. And it really depended on what their current situation was. If they needed something that was private, maybe other people would hear them if they were calling. It gives them some different options in the ways that they receive their help.
Any data yet on just what is prompting the kids to call, the most common problems that prompt kids to text overnight?
Yeah, overnight specifically, the top sort of 4 issues are anxiety, stress is related to that, relationships and navigating those dynamics, depression, and unfortunately even self-harm and suicidal thoughts.
Well, that is worrisome.
Very much so.
What is the protocol of Kids Help Phone when you get a text from a young person who admits they're thinking about harming themselves?
Well, that does sound grim, that might be one of the top issues that we're supporting young people through, but I do need to underscore that these are young people that may be considering this, and they've reached out for help, and then in that moment we can safety plan with them, we can think of solutions, we can help them decide how they might access other supports in their life or tell the parents that are in their life about the thing that they're struggling with. So really, it's important that we're taking those conversations and making those action plans with young people so that they stay safe.
I would think that with that type of an increase in overnight texting, Kids Help Phone might need more overnight workers. Is that the case?
That's absolutely the case. In fact, right now, we have a call out to Canada to help increase the donations to Kids Help Phone so that we can hire more staff, actually throughout the country. So the time zones in Canada play to our advantage. So we can have people hired across the country that can provide that coverage overnight for young people, no matter where they might be contacting us from. So this is a way that public can help us meet this new demand, is to help support us with donations so that we can hire more of those qualified staff.
And I would guess for Quebec, you'd need French language speakers as well.
This is critical. We, in specific communities and provinces in Canada, Quebec being the most obvious, that French language capability means that we can be there for young people in both official languages over text message.
Aaron, thank you very much for joining us. Where can people find out more about Kids Help Phone?
You can go to kidshelpphone.ca and find out more about all of our services and also make a donation.
Aaron Sanderson, President and Chief Executive Officer at Kids Help Phone Foundation. I'll be back in a sec.
The newest tracks. Let's go. New music. And the next big thing.
Always on the new music first.
Your first place to hear it all.
'Cause you gon' like it, love it, wanna play it twice. Playing now.
iHeart New Music. Your digital station for brand new drops, fresh finds, and tomorrow's bangers.
I think we need something new.
Discover iHeart New Music. Always fresh, always first. Stream now on the free iHeartRadio app.
Sincere thanks to the team, the brains behind the Elias Macco Show operation in master control, the master of the board, Jay Farrar, content producer Maxime Cadot, always on the phone. We appreciate the efforts of both of you guys. Thank you very much. It's clouded over here in the eastern part of downtown. We are told there is still a chance of thunder showers this afternoon, a risk of a thunderstorm at about 40%. Humidity, it's going to make it feel like 38. That's a little warm for my taste, but still, it's August in Montreal. Enjoy the rest of your day.
The newest tracks. Let's go. New music. And the next big thing.
Always on the new music first.
Your first place to hear it all.
'Cause you gon' like it, love it, wanna play it twice. Playing now.
iHeart New Music. Your digital station for brand new drops, fresh finds, and tomorrow's bangers.
I think we need something new.
Discover iHeart New Music. Always fresh, always first. Stream now on the free iHeartRadio app.